Hey guys, it's Dr. Nelson. Welcome to Advocate Wellness. I'm a chiropractor here in Keller, Texas. I've been in practice for about 4 years. Our goal is just to help people heal, feel, and function better. So one of the things that I see a lot of is neck pain and shoulder pain and peripheral neuropathy. One of the things I've found is that people who carry the weight of the world on their shoulders really find that they have a lot of neck and shoulder problems. One of the things that stands out to me is that there's not particularly one clinic that I've really found that puts together all three elements of treating joints and the muscles and the nerves, and we put that together in a unique way. Now, some of you might be familiar with some of the technologies that we use, some of the treatments that we use. You might have experienced chiropractic before, but never like this. Let me show you around. So first up, we have the red light therapy room. Now, a lot of times the lights are down in this part. We do treat people who are light sensitive, but we also want it to be a really relaxing experience. Towards the end of a treatment, or towards the beginning if you're a little more nervous, you might spend up to 10 to 15 minutes in one of these reclining chairs, and we provide red light therapy. Now, red light therapy, as you can see here, shines a bright red light into the body. The SparkNotes version is that it decreases pain, decreases inflammation, and speeds up healing by 2 times. We have a number of different frequencies available to us that do a number of different things in the body. So just like the remote to the DVD player only changes the DVD player and not the TV, different frequencies do different things in the body. This is now an infrared frequency that handles pain and inflammation more. Red light helps with blood flow more. And then we also have these sets of pads which we can put between you and the chair so that we can apply the infrared light directly to your spine. All right, this is my main treatment room right here. So the whole goal of the clinic is for it to be set up more like a living room. So it feels like you're coming to see your friends and you leave feeling better. We want that homey atmosphere. We want you to make yourself at home. We do have an open concept treatment, so people are walking in. A lot of the patients get to know each other. They pray for each other. They encourage each other. They get to know each other's stories. It's really beautiful. I have my whiteboard over here because I'll go over different concepts. I'll explain things to people, draw pictures so I don't spend too much time talking. And then this is my main treatment table here where I provide chiropractic adjustments. We analyze what needs to be adjusted based off of the Zone School of Healing method by Dr. Pete Goldman and his predecessors. And the idea there is that you can have emotional or you can have physical triggers for problems in your body, and oftentimes an overlap of both. So we co-manage a lot of our cases with a lot of therapists who are wonderful and help to remove all of the emotional stress that is showing up in the physical. We can't make your life easier, but we can make you more capable of handling all the stresses that your life brings to you. As I mentioned earlier, very few other clinics actually address the brain-body connection just as directly as we do. So your brain is trying to talk with your body and your body's trying to talk with your brain. But if the nerves are inflamed, it's like trying to get a friend to your house. It's dark outside, you have a bad phone connection, and they've never been there before. It's going to be very tricky. Inflamed nerves are like playing a game of telephone. So if nerves are inflamed, they tighten muscles. Tight muscles lock up joints. Locked up joints irritate and inflame nerves. And the circle goes round and around and around until you have an appropriate intervention. And so what we do is we provide adjustments to help make sure that the joints move properly. We provide myofascial therapy, which just breaks down to myo, the muscle, and fascia, the envelope around it, to make sure that that's released so that your body's loose enough to, first off, receive a comfortable adjustment and for that adjustment to hold longer. And then we also provide the red light therapy over here to help make sure that the nerves calm down. And that helps us to be able to interrupt that downward spiral at each and every step, clarifying the brain-body connection. We don't fix you, you fix you. We remove the interference to the normal, natural way that you're supposed to heal, the way the good Lord intended. So when you first come in to Advocate Wellness, you're going to see that sign with a person gripping their shoulder. You're going to turn right. This is going to be the first door on your right side that you're going to find. In this room, we have reception. Miss Christina is usually sitting at this desk right here. And then she'll welcome you and get you a tour, be able to offer you something to drink and a restroom break before we get started. We start with a consult before the exam. I want to make sure I listen to every word you have to say. If at any point I feel like someone else is a better fit for your care, I'm going to tell you exactly who that is. If I believe I can help you, we do the exam. And if at the end of the exam I'm still confident that I can help, we provide a sample treatment, after which we go over my expert recommendations for what's wrong, what it would take to fix it, what your options are, and what I think would be best for you, and we custom fit that recommendation to you. If you arrive early for an appointment and no one's immediately there to greet you, just go ahead and pop on back over here. If you see this sign right over here, if this sign's not on, it means doors open, please come on in. Just call for me. I'm right back here. I run an open door policy. I'm oftentimes busy back here either like checking on documentation or starting to develop some films. And we provide a lot of free resources for people online on our YouTube channel or on our Instagram, because we don't get to work with as many people as we would obviously love to help change their lives. And a lot of people either are limited and as far as their ability to come see us, and they need free resources. So we film those and when we put them up again on YouTube and Instagram is where we're most active. Advocate Wellness TX, you can find us there. Find those free resources, share them with your friends and your family. They're there for you to share and help people. Simple things that can help people either for free or at no additional cost to them. And that's just my gift to my community, and I hope you help me share that. Thanks so much for coming on this tour of Advocate Wellness with me. I'm Dr. Nelson. If you are looking to become a patient, you have neck pain or shoulder pain, or you have numbness or tingling, burning, shocking sensations in your feet, and you would like to take advantage of a new patient special, please go ahead and reach out. We discount it deeply to make sure it's a no-brainer to be able to find clear answers on what's wrong, what is the root cause, and what it would take to fix it. If you're a clinician or a professional in our community that's focused on wellness, please also reach out. I've recently started the Keller Wellness Coalition, and it's a group of like-minded professionals who are dedicated to finding out how we can refer to each other better for the ultimate wellness of the patient. We have professionals in the financial sectors, in wellness, in hair care and cosmetics, chiropractic, and many, many other fields. If this is inspiring to you, please reach out. It's completely free. We're just looking to come together and be able to improve the quality of our community, one life, one connection, one relationship at a time. Thanks so much for watching.